Good morning, guys. I hope we're all sparly. What are we going to talk about today? Let's talk about your options when it comes to testosterone replacement therapy. Because once you've exhausted lifestyle, diet and exercise, you've looked to reversible causes such as hypothyroidism, you are faced with a lifetime of testosterone replacement therapy. Now we're going to dismiss pellets because they're a waste of time. We're going to dismiss transscrotal testosterone cream because it's not licensed, and the absurdity of having 100 milligrams of testosterone cream applied to the scrotum twice a day and it not raising DHT, but doesn't matter if DHT's raised. Everything in balance, guys. Everything in balance. We're going to concentrate on what we actually offer at the Men's Health Clinic. Now, as you are aware, we subscribe to microdosing, using the minimum effective dose in the correct manner to achieve the desired outcome. Stable male androgen levels to allow homeostasis. This complex process whereby you maintain a stable internal environment despite external changes. Understanding the need for contrasting processes within the body for harmony. Anabolic, catabolic, parasympathetic, sympathetic. The list goes on. So what is the most effective ester for achieving stability? Well, that's not actually the right question, because you can achieve stability using all sorts of esters in all sorts of different ways. Now, when we come to hormonal diurnal variation, we want diurnal variation. Now, can you have diurnal variation in testosterone replacement therapy? Now, with an understanding of pharmacokinetics, you can achieve relative stability. So the main determining factor for that is the ester, essentially the length of the carbon atoms, the route of administration, topical, sub-Q, IM, your SHBG. This is the buffer that binds on to testosterone, estradiol and DHT for its actual primary purpose, growth and repair. So not only does it make sure that you don't metabolize all of your androgens too quickly, it actually helps modulate the transfer of testosterone, estradiol and DHT into the cell for growth and repair. So the feel-good free testosterone is actually a slightly secondary component to testosterone. It actually is not the primary reason why we have testosterone. Obviously, it's incredibly important because, again, we go back to this concept of balance and proportionality, but it's not the be-all and end-all of everything. So lots of guys want to crash their SHBG to free up testosterone, not realizing the premise behind this essential anabolic hormone. So when it comes to dosing, the dose is largely irrelevant. It's the effect that dose has on your physiology. The frequency of injections, as we've said, can be determined by these other factors. But what we really want to have is an ester that really mimics natural physiology. We want an ester that, if there is a problem, we can change the dose or frequency of injection to affect a positive change to that side effect. This is one of the reasons, whilst microdosing testosterone on decanate at around 125 milligrams weekly is great, because it does provide stable levels, and it's actually really suited to guys with SHBG levels in single digits who cannot get stable with cypionate. But managing side effects is a problem because of the extremely long half-life. So there are always pros, there are always cons with everything. But through our experience, we understand that daily microdosing of testosterone cypionate is the most effective way of achieving stable levels. Now I hear you say enanthate. Yes, enanthate. We also use enanthate. This is typically prescribed by the GP who has been kind enough to support their patient in their journey towards hormone optimization. Enanthate is less suited to subcutaneous injections, which is our preferred route of administration. Why? It's less painful and there's less aromatization of testosterone to estrogen. Now you need testosterone to aromatize to estradiol, but the right amount. As we've said before, there are two tissues within the body that you can directly influence your propensity to aromatization. That's liver and adiposity. But obviously when you're injecting a fixed amount, your body has to react. So if you give yourself a hormone, there is undoubtedly a physiological reaction that then leads to a psychological reaction. The power of hormones should not be underestimated. You've only got to look at female PMT every month, and they still have troublesome psychological symptoms that as a direct result of a change in physiology. Do not underemphasize the importance of hormonal stability. The transition from from low testosterone to normal testosterone hopefully is a positive one, but again, pharmacokinetics, peak trough until you really reach stable levels, which is essentially 5 half-lives. There can be fluctuations in your mood. Obviously with an excess estradiol compared to testosterone, you can have negative side effects. This is a really complicated field of medicine. So what you want to have is an ester that not only achieves your desired outcome, but you can also modulate side effects from changing the protocol. So enanthate and cypionate are interchangeable from a half-life perspective, but from a route of administration, sub-Q is our gold standard, and cypionate is much better tolerated than enanthate. Although we are happy to support our guys, because obviously it's free through the NHS, and it obviously costs through us, because we are a private medical clinic. We've also got guys, as stated previously, on Nebido. Now we don't prescribe as per the manufacturer, because they may have reported steady levels, but I think everybody knows that Nebido injected every 12 weeks is prone to peaks and troughs. Now I had a little discussion with a prof who was saying, well, the rate of rise in hematocrit is greater with cypionate than it is with Nebido. Well, it is if you're injecting 1000 milligrams every 12 weeks compared to 250 milligrams every 3 weeks. The actual daily dose is different. The daily dose for Nebido is less compared to cypionate, and you are causing peaks and troughs. But that's not how we prescribe testosterone. We use the minimum effective dose in the correct way, and that is a daily small dose of testosterone to mimic physiology. Your body naturally produces between 6 and 10 milligrams. But I'm not average, I hear you say. Well, you may not be average, but the average person is between 6 and 10 milligrams. Some of my monsters are on up to 25 milligrams of testosterone a day. Now, as I said before, the dose is irrelevant. It's the effect it has on your body. So these guys who have a higher than average musculature and who are extremely active need more testosterone to achieve normal male androgen levels. You've also got to remember SHBG. So if high SHBG means that obviously it's going to get mopped up. So you actually have to have a higher dose of testosterone to achieve normal levels. This is all about balance and affecting a positive change to the patient. Whilst the guidelines are incredibly important because they provide us with some assurance that this field of medicine has been researched, if you have sufficient clinical acumen and expertise and you've shown due diligence, you can prescribe as per the best interests of the patient. Incredibly important. So there is no one-size-fits-all model at the Men's Health Clinic. I've actually changed some of my guys from Cypionate over to Libido. And these are the guys with single-figure SHBGs who have not been able to get stable. Disappointing, but it is what it is. We have to work with the tools that we're given. So when I say going on testosterone replacement therapy is not a trivial decision, it is not a trivial decision. Is testosterone replacement therapy worth it? If you need it, it's 100% worth it. We are mimicking physiology as best we can. We are not using it as a performance enhancing drug. Now, does it improve your performance? Well, if you normalize your physiology, of course it does. Much like a car engine, you need to put the right amount of fuel to oil mixture. If you disrupt that and put too much fuel in, you'll wash all the oil from the bearings, and ultimately that engine will go boom. We have to get our heads around this concept of balance and working with the body, not against it. Now, what else do we prescribe at the Men's Health Clinic? We've got a few people on the gel, but they're on the gel alongside HCG. So essentially HCG acts as the base and testo gel acts as that little spike that you're hopefully going to get from a natural testosterone production in the morning. And this is all theory, obviously. But I've got some guys who are super happy on testo gel and HCG. Now, I've spoken about HCG numerous times before, so I won't go on about it again ad nauseum. But essentially, we are trying to replace the hormones that are deficient in testosterone deficiency. Now, irrespective of whether you're a primary or a secondary, testosterone monotherapy suppresses the pituitary and hypothalamus, so you don't send LH and FSH down to the testicles. Hence the reason why we like the idea of HCG and hormone replacement therapy, not testosterone replacement therapy. Does it suit everybody? No, it doesn't, disappointingly. Now, Joseph's just doing an article on the other effects of HCG outside of fertility. But it certainly appears that a little bit of overstimulation of the neuroendocrine system can worsen psychological symptoms, especially in people with anxiety, who are prone to anxiety. So this is a fascinating, evolving field. So do watch this space. So Joseph's, as I've said, he's just doing an article on this very subject. Because we are essentially guinea pigs. But rather than moving to excess, which has been our problem from day one, distorting our physiology, we like a little bit more of a common sense approach. I think we can learn everything that we need to learn from nature. We've been given the tools. Disappointingly, we don't use this. We are prone to excess. We are prone to seeking the path of least resistance, not understanding that there are literally thousands of physiological processes going on board. They are incredibly complicated. They are incredibly complicated to make our lives incredibly simple.